All right, it is December 18th, 2020. This is Coronavirus Inside the Arizona Numbers, where we take a closer look at the numbers coming out of the state of Arizona to help you make the best decisions for your life and your family. We always say you know their health and lifestyle best. We're here to guide you through the data and the numbers as they come out. A lot of news breaking in the last few hours, a lot to get to, especially here in the state of Arizona. We're just learning that the police chief has been diagnosed with COVID, also the assistant chief. So lots to get to in this hour. And we'll start, though, where we always do with the numbers that were coming out overnight. Garrett.
Absolutely. So let me just, I had a couple things open. Here we go. Okay, 7,635 new cases reported today. That is the fifth highest report that we've had. The number of deaths reported, 142. That is number 6. The 7-day case average is no longer at its record. It's now at number 2. We're at 6,880 cases on average in a 7-day period. And then the 7-day death average, this is now 82. That's the third highest we've seen so far. So that's where we are essentially on our reporting numbers. We're still sort of in this peak. Now, we do have some, I'll say good news. I'll say good news. So we have some good news that we can go over really quick. I'm going to go through the cases by day right now. And if you notice, we have our highest day is November 30th, 7,835 cases added that day. But notice something. We now are 2 weeks away from that. And for the last week of reporting, there was no real case increase. In fact, we're only about at a 10% or so case increase from week over week right now. That is very good news so far. It does appear that as of right now, we are leveling out. We're peaking. We're at a summit. I don't know how long this is going to last, but right now it does appear that we are there at a summit right now.
And is there any forecasting on what Christmas then could do to that, as we saw the slight bumps, if you will, after Halloween and after Thanksgiving? Are there concerns or projections at this point that you've seen regarding that?
So the projections I've seen on Christmas doesn't appear to, Christmas doesn't at this point appear to have any impact on the virus spread as far as the projections are concerned. It may be something where as time, it's slowing. It may have some impact, but because of other variables such as people not traveling as much or not going out as much during the same period, that sort of also impacts the numbers and changes sort of the way that this thing calculates. But if we look at the way that things look like at the University of Washington's model, which we'll go over, it does not appear that Christmas is going to have that much of an impact on these numbers.
All right. We got a pretty detailed update on how our hospitals look a little bit earlier today. So if you're interested in learning more from Banner Health, they gave a briefing. You can find that on our Facebook page right here, just a few posts back. And we covered that entire thing. Some of the key takeaways in all of this is that over at Banner, Garrett, 49% of all the patients, 49% of all the patients they're treating right now are COVID patients. And we also learned, sadly, that they have exceeded their morgue space and that they have brought in those refrigerated trucks. Some of the trucks that we saw over this past summer, they said they have the capability of storing 48 more bodies because of that now. But just such a sad time right before Christmas to see that those numbers are hitting such highs. How do things look for our hospitalizations? Now, that's Banner specific. How do things look overall for Arizona?
Banner will have the biggest impact on this number because it is the largest hospital system. So as you just said, with that one hospital saying about 49%, you can see the inpatient numbers here for the entire hospital system for COVID-19 is about 46% of the licensed beds right now, with the other percentage being 47%. So really it is a 50-49 situation in the actual beds that are occupied right now, where about 50% of the patients are COVID-19. And that does also appear in the ICU numbers as well, where the numbers are 52% to 41%. So there are more COVID-19 ICU patients than there are the opposite at this point.
So, with this concern over the ICU, specifically with that, we had a closer look at those numbers yesterday through reporting with Mike Pelton, and I know you spoke with him on some of that information as well, and trying to figure out where those ICU beds are. This just provides an overview, and anybody can find this graph and this chart on the state's website. It doesn't spell out specifically where the beds are.
No, I do have. So there is some data on that. Let me see if I can pull it up really quick. Just one moment.
And yeah, and as you do, Garrett, it's one of the things we saw in our summer peak as well. I know you'll remember well in our reporting on that, when we would see stressed out ERs or stressed out ICUs that were overrun with people, and we'd hear from doctors and nurses who were saying that wasn't what they were seeing in other parts of the state. So it can be a very different situation, rural versus the more populated areas of the state, and how they're getting hit. And when we look at these numbers, it's a broad overview of the state of Arizona.
Yes.
So it's important to remember the different situation in different parts of the state, and why it's so important to know where those ICU beds are specifically. We're seeing in California, they were saying zero capacity. They have no room left anywhere. It is a bit of a different story that we're seeing here, although we're quickly approaching those numbers.
Correct. So let me see if I can get this done here. I'm looking at that. I'm trying to get the hospital information here for Arizona. This is not from the AZDHS. This is from the HHS, the federal HHS, which they also are tracking data. The hospitals are required to give them data as well. Although just the difference between this data set and the one that we use constantly is ours is done every single night. This is only updated every week. And so we do actually, but it does have some information on the actual patient or the actual hospital facilities. For example, we can see that Banner Desert has about 196 COVID-19 patients there, about 23 ICU beds available, and about 78% of their ICU unit is occupied. Banner Thunderbird, about 93% of their ICU unit is occupied. And if, in fact, we can just sort this and see what all of these look like. Hopefully, let's see if this is working here. I don't go to this page that often. It doesn't look like it's going to want to sort that way, so that's fine. But when we look at these, we can see what this is. What this is Coders report. I think we've shown this before. This is reports.codersagainstcovid.org/hospitals. And so this way you can go through this hospital by hospital and look at what their weekly estimates are on their ICU, on their COVID-19 patients and their available beds, as well as what the estimate for the available overnight beds.
And Garrett, wouldn't there be such challenges in tracking this just because we're losing so many people each day? I mean, if we had 142 deaths reported in the last 24 hours, 68 of those in Maricopa County alone. I mean, that alone, outside of discharges or, people getting out of the hospital, that alone would seem to be such a challenge in tracking all of this.
Yes, absolutely. It is a challenge, and that's one of the problems with this whole thing is that we're recording and looking and digesting data that typically is not digested and analyzed at the same rate that we're doing. It's usually done once a year, maybe a couple times a year by dedicated health analysts.
Mm-hmm.
And so they're putting out all this numbers in real time, but it's continually being revised. There's nothing to compare it to. I know some people will say, oh, well, what did the hospitals look like with the flu last year? And their answer is, I don't know. I don't know exactly what the hospitals look like because we didn't have daily bed counts last year. We can tell you that there were reports in certain flu seasons where 1 or 2 days of the hospitals were filled up, but nothing like what we're looking at where we've been in a sustained situation where all the ICU beds, not all of them, but most of the ICU beds are taken up for a sustained period of time. And so, like you said, it's the difference in reporting and the difference in the way the data is presented and the difference in analyzing it can be challenging sometimes.
Yeah. All right. Let's talk a bit about the hope in all of this, and that is, of course, the vaccines. And we're seeing some people get their vaccine on camera in an effort to sort of help anybody who's having some fears about this or trepidation about this. Vice President Mike Pence just got his shot today. President-elect Joe Biden is scheduled for next week. President Trump, we have not heard from. He was tweeting today, but not a part of that event. Kamala Harris is scheduled for a week from now. So people starting to get the vaccines. That's fine, but people also want to know, who are the frontline workers? Who are these healthcare heroes who are out there getting these shots? Who are like, where are these numbers? And is that data then going to be public? I know of 6 states who came out today and they're presenting their statewide data on this. What does this look like for Arizona? Do we have something similar, or where can folks find that as we start to track a more hopeful number in all of this?
So we do not have statewide data for vaccines, but we do today. Maricopa County did release at least some statistics on vaccines that are being done in the county. And so as is typical, we have to sort of rely on Maricopa County for this data. So basically, this is all the dashboard is. It's not much more. It says how many points of dispensing points, sites to get the vaccine are open. It tells you the phase, which is phase 1A. And then it tells the amount of doses, 1,000 doses essentially across the county at this point. And then the volunteer hours, 191 so far that have worked on this. And you can see it will continue to update us on what phase, if you're in Maricopa County, what phase we're in. 1A phase, and you go down here, you can see what they mean by 1A. So right now they are only doing healthcare workers, emergency medical service workers, and long-term care facility staff and residents. Those are the only people eligible for the vaccine right now. But as we move into phase 1B, it will then tell us this. It can say healthcare workers not included in 1A, adults in congregate settings, that is sort of correctional facilities and whatnot, law enforcement, teachers and childcare essential workers. And then the last 1C is 65 and older, adults of any age with high risk comorbidities. And then we get into the spring. All they have is an estimate for spring 2021 for phase 2. And this is where the final sort of the general population shows up in that.
Right. And as you mentioned, we are only in 1A, not anywhere near moving into that next phase. And we had that delivery to Maricopa and to Pima County, and then other counties waiting for their delivery. And also
we have far more people than 1,000 people in Maricopa that are healthcare workers and are in long-term care facilities. We have a lot more to go until we get there.
I know a lot of people have been asking, when is my group? It's like, we wish it were as easy as a Southwest flight in the old days where you could just get in line. But at this point, we're still in this phase 1A, and hopefully getting this Moderna vaccine going soon, that will help alleviate some of the stress in getting all of these doses out to everyone. We reported yesterday a little bit about those vials showing up with, say, like 7 doses in there when they expected 5. And we want to remind you that they are cleared to use those extra doses in there that came. They have said that that's safe and that is appropriate to be using. So hopefully that will in itself help to alleviate some of the stress of not getting enough for everybody. But that chart is, I saw some people asking where they can see that chart. That looks like a Maricopa County chart.
It is. If you go to Maricopa County's COVID-19 site, it has, we've been there a couple times. It's where they show their dashboard and their information. The line down from that literally will say vaccine. It's a picture of a vaccine needle, if you will. And if you click on that vaccine picture, then it will bring you to that data.
Yeah. So state by state, if you're watching from somewhere else and you're looking for that, there's about 6 states, South Dakota, Texas included in that, who have statewide information. But ours, as Garrett pointed out, you can see through Maricopa County. I just saw a moment ago in the comments as well, Sonia had posted about her brother, and she writes, "My brother had COVID-19, was released from the hospital. He went home and died within 2 days. My heart is torn. Why him?" And I first of all, Sonia, want to express my condolences for your brother. And I know there are so many Arizona families around the U.S., around the world, going through this right now. And as always, when we talk about these numbers, we remember that behind every single number is a family member, like Sonia's experiencing, her dear brother, that we remember and reflect on that as well. So I'm sorry for your loss, Sonia.
I see that someone is putting, Karen is saying, so prisoners get it before law-abiding citizens. Now, yes, the reason is because this is a congregate care. This is a congregate setting. These prisoners are not allowed to leave, and this thing spreads in those situations at a much faster rate, and it also impacts staff. In fact,
Mhm.
the warden of Yuma Prison, or a correctional facility in Yuma, has just passed away from COVID-19.
The warden, a
Yes,
warden
the
there.
warden did.
You're right.
Yes, so this is not something where we're just vaccinating the prisoners first. There are people that go in and out. This goes to and from the community from these correctional settings. They're sort of hotspot points
Yes.
that they have to take care of.
Yeah.
It's the same thing with long-term care facilities. They
Yeah.
have to take care of these sort of points.
You're absolutely right. And it can affect a whole community, as we've seen in
Yes.
Yuma. We had at that particular prison that you're talking about there in Yuma, we had 600 plus inmates test positive. So more than
Yeah.
half the inmate population. So you can see, what they're dealing with there. I do want to mention the correctional facility has not publicly said that he died of COVID, but ABC 15
Sure. Thank you.
has looked at internal emails that we have seen and witnessed that say that that is the case. They were just protecting health laws, but of course, in communications with so many people as they have to, there on the staff, it is become more public email. So
Yeah, it's a very sad situation, but again, it's
awful.
these congregate settings are the absolute highest risk of COVID-19 transmission, not just inside, obviously, especially inside, but also to the greater community.
Yeah,
And so they have to take care of these. They have to be in a phase before the general population. We have the ability to stay home and stay away from people if we so choose. A prison warden, staff member at a prison does not have that option. They are an essential worker. They have to be there, and so they have to contain that virus in that congregate care facility before it gets worse. So
yeah, and it's all part of public safety. So essential by
yeah.
1,000 different ways. All right, I just want to update you on some information that is just coming in within the last few minutes. ADHS got fewer doses than they thought, unfortunately, like other states, and we knew that part was coming, but they're saying that Arizona did not get the full expected allocation of Pfizer COVID-19 vaccines for the week specifically of December 20th. So the Department of Health is asking the CDC for an explanation right now for the difference, and right now, as of this moment, they're awaiting the response. So as soon as we hear from them or they hear from the CDC, we'll pass that along to all of you. But as a result of this difference, so they were expected to order 70,200 doses of the Pfizer vaccine for next week. So starting Monday, as a result of the difference, they were only able to get 41,925 doses. So a huge difference there, pushing for answers as to why that happened, but that's coming up for next week. So we'll continue to track that development, as I mentioned.
Nancy has a very good question about winter visitors testing positive. Is the data counted in Arizona, or does it go to their county of residence?
Mhm.
That's a great question, Nancy. The answer to that question would be it will likely be counted first in Arizona, but because since the system is very much tied to medical billing, at some point, if the person goes home, it could be transferred out of Arizona and to whatever county of residence is outside of Arizona. So
Mhm.
the answer is yes initially, but if that person does, take up residence again and still has COVID, then it would transfer over to wherever it's from. But initially it would be here.
Yeah, I just want to mention today is as I said off the top, December 18th, but it is Friday, and for most kids here in Arizona, it is the final day of school before fall break. Whether it's the final day of remote learning or if they are still in in-person learning, so many changes have been announced. So many changes still to come on whether to go back to school January 4th or how far out these schools are now pushing their projected return. So I want to remind you where you can find the very latest information as it comes into our newsroom, and that's our schools section of our ABC 15 website. So that's abc15.com/schools, our very latest reporting there. I tell you what, Garrett, I don't know about you. I've never, since college, I haven't been so excited for the end of the semester, helping my kids manage homeschool while still working full time. So it's a pretty busy feat. So I know there are a lot of parents, both in the comments who are watching us now, who are just like, Oh, we made it. We made it to the end of this semester, and for
With
how
my,
much
we're in the same boat.
yeah, yes, yeah, we are all there. My gosh. Oh, yeah, Kristen writes, my kindergartner still had fun winter celebrations with school today. Mine too. She writes, I'm so thankful for our teachers making things almost as normal as possible. I know it was nice. My kids got to do pajama day at school, which was just like, okay, so you're eating your breakfast and then you go to the camera and start doing Zoom school and no like official learning today. They got to watch a movie and do some of the fun activities that they still would have done if they were in person. So I agree. These teachers have gone the extra mile to really make sure today was as close to it is when they're actually in school on that final Friday when grades have already come out and there's nothing to worry about till January 4th or beyond. All right. So Garrett, as we track these numbers, the projections are always a big question. I know we spent a little bit of time on that today. If there are sites that you are loving the most right now for projections because of maybe their accuracy or stability, what would that be for
I'm still sticking with IHME for now. I
yeah.
think it's the easiest to read. They are very good about now allowing you to take out the extra projections that they're making that might be a little bit more based off policies that are unrealistic at this point.
Hmm.
And that was one of my biggest problems with this site early on, is there was no way to remove these projections. And so when people were looking at them, they're saying, wow, this is going to be so, it's going to blow up in our face. And now they give you the chance to say, look, we're not going to have easing of the mandates, but we're also not going to have full 100% or 95% mask compliance. So let's remove these from the projections
Mm-hmm.
and just look at what is going on right now. And so far, they've been tracking very, very well with our data as it stands. So I am using the University of Washington model a lot more than I used to.
Oh, the nice
Looking,
thing about that for people who are watching from other places, it's still got that pull down bar.
yes.
So you can check other states, maybe where you have friends or family living and get
Absolutely.
a
So like
projection
I'm
of
on
their
the
area.
global right now, but we're gonna type in. You can just type in whatever state. It even has other countries, like you said, anything, and basically look at where we are. So I'm only keeping two things: the projection of where they think we are based on our current policies and current everything data, and then also what a rapid rollout of the vaccine. Now, obviously, with what you're talking about with azdhs saying that they're already complaining that we're not getting enough vaccines, maybe this isn't going to happen. So the difference, of course, being that if you notice, it really doesn't change the projection all that much. I think there is there's only rapid vaccine rollout to high risk as a category. So I'm going to just use that one instead because that looks like that's going to be the only thing we have. And you see, again, it doesn't really change much. It does believe if we go down and we take out all of these and we just look at the projection and then do rapid rollout with vaccines high risk, you can see our daily death numbers will continue and will peak at around January 5th. So the first week or so of January is when our death numbers are going to peak, and then they're going to fall until we have April, where they're going to be in the 10s and 15s again in April. When we look at the daily infection numbers, and again, we're going to take out the easing, we're going to take out all of this. This is very interesting right now. You can see it believes that we are in a peak, but it's dragging us down. And this wasn't like
Hmm.
this yesterday. This is very interesting. I wonder why. We probably have to wait for them to do a computational update this weekend to see why they're dragging us down so much, because that doesn't make sense. It's almost like they said, oh no, I presume what this means that they're going to recalculate the peak, and it'll probably be in the Christmas or New Year's areas when they're going to recalculate the peak, because our current numbers are moving up faster than what they had originally anticipated.
Hmm.
So they'll probably recalculate this and give us something a little more accurate. Again, they only recalculate. They don't recalculate this every day. That's one of the problems. We're looking at an error where, I wouldn't call it an error, but this is something it's gonna recalculate and they'll reproject, and something like this won't occur. But I think their reprojection is coming this weekend. So
So Garrett, earlier in the pandemic, they were sort of recalculating twice a week. There would be like a Wednesday update and a
yes.
Saturday, Sunday update. Is that still what you've seen from them?
No, well, it looks like they just updated this December 17th.
So yes.
But no, I don't know. I don't think they're updating it every other day. I'll have to look at it. I'm going to start pulling their data down more often. Uh, in machine learning so that I can do a little bit more stuff with it.
I think that's kind of it sounds great because that's a big question right now is how much longer and when do we really start to see the change in these graphs because the vaccines are showing
Yeah,
up.
I mean, right now we've been, as I said before, our case numbers appear to be peaking at this point.
Yeah.
That's just what our current data looks like. That it is in fact peaking. I don't really know what's going to happen right now, but like I said, it does appear that way. We have, I mean, even and the Navajo Nation is actually on a decline right now, and they usually lead us. There's the Navajo Nation usually it gets hit first, and it
Mhm.
starts to get better first, and then the rest of the state follows that pattern. So it does appear that we could be. There's a couple more indicators than there were last week that we are headed towards a downswing right now.
So, this is an Arizona-based conversation. I don't want to spend too much time on California, but some numbers out of California yesterday say if California were a country, it would rank third for new cases. So, United States. This is for December 16th. So this would have been 2 days ago. I haven't pulled the numbers for today or yesterday, but if California were a country, it'd be ranking third. The United States having the highest number of new cases, Brazil coming in with the second highest number of new cases, and then California. So the breakdown was like 247,000, then Brazil was 70,000, and California coming in with 53,000. My gosh, that's got to be a consideration for any Arizonans who are considering travel to California over the holiday.
Correct. If we look at now, I was looking to see if I could do this by like take California and put it against countries, but I don't think I can do that. But what I can do is show you what it looks like against each other on this graph. And we've gone to this a couple times.
Yeah.
So this is California. As you can see, this is not factored in by population, but you can see obviously between California and Texas, which are our two largest states, California is just surging like crazy compared to Texas, which is much more flat in the number of cases that they're adding. California, as you said, 38,000 cases in the past 7 days. That's what their average looks like. So yeah, and then this is again a 7-day average. But when we go down to normalized, which is per capita, it does get to be a bit different. You can see Arizona's right there. We are in the upper tier. We're no longer in the middle. But let's go put on California as well. California just actually passed us in its numbers. And that's pretty much the only difference. Tennessee, Rhode Island, California, then Arizona. So really, us and our neighbor are pretty much the one of the top 5 right now in per capita, of course.
One other thing to mention, I talked about Chief Jerry Williams as we started, and the assistant chief also testing positive. Now, I can tell you that they are experiencing mild symptoms and per protocol staying at home, working from home at this point, but obviously something to keep everybody updated on. Once again, Chief Jerry Williams of Phoenix PD, one of the largest police departments in the country, I think the 5th largest in the country. So obviously of concern right now, and we wish her and also Mike well, and that we hope that they get better very soon. The other thing, the Washington Monument has closed over concerns that there was a private tour that went through from the Interior Secretary, and that exposed the staff to coronavirus. So changes all across the country as we track this info coming in. And one more thing, as we noted the states, I always kind of keep you updated on the states with the highest numbers overnight. We just talked about California. California was at the top of the list. Then Texas, Florida, Ohio, and New York. So the newcomer to that group being Ohio, but they've seen that bit of a spike lately, Garrett, too. Okay, we're heading into a weekend. We have a high number of tests still coming in, despite some problems happening over at Emory. For those of you who got tested over there, are being asked to retest because a lot of people's sample was sent to a lab that just wasn't capable of the sheer volume, and they've switched the labs altogether, asking people to come in and retest. But how many tests are we processing here in Arizona each day at this point, Garrett? And are we close to a high? Has that sort of leveled off?
Sure. Let me go over to that. That's again a great place for the azdhs dashboard.
Mm-hmm.
So we're going to go to laboratory testing and see what things look like right now. The number of people tested, 23,138. That is, we are, like I said before, we're sort of in record numbers there. This is a top 10 number of reported. I think this is number 9 of the number of cases or tests reported. The curve continues to climb, so we're on average testing more people on a regular day than we would otherwise. There is this other dashboard where we can see what this looks like when we actually take out the, now we're looking at the healthcare workers in the congregate settings in the department and the correctional facilities. Anyone that's being tested multiple times, now it's 55,000 tests reported in Arizona yesterday. So this is what we're talking about when we say, like when the government said that they could do 60,000 tests a day, they're doing 60,000 tests a day. We're just only really seeing and talking about 23,000 of them because those are the new people going and getting tested. This 53,000, this is pretty much, again, all those people that have been frontline workers and essential workers for this long who have to continually get tested. This is their number.
Yeah, incredible. That for where we've come, when in July we didn't have anywhere near that kind of testing. Micah's asking, so is this our percent positive effect? Is our percent positive affected by this then?
Affected by what? Our percent positive. So this is a different percent positive. You have to understand the difference between the two. So if we look at this, this is the diagnostic test of all of these, including retests. You can see it's lower at about 16%. When we go to people tested, which would be more recent, it's at about 18% right now. And it has been fairly level. That's been what our number is. So the difference between these two dashboards are, these are deduplicated. I know people have been talking. I remember, like, we used to get questions a lot from people saying, "Oh, well, what if someone goes in and gets tested 3 times? They're going to be in the system 3 times." Well, the AZHS split this dashboard up to say, no, that's not what happens. We actually do dedupe this information. So this 23,000 is unique. This is the tests that were done, and then the all tests, which were done with people who have already taken the test as well, because again, they're in a congregate, so they're in a correctional facilities. They work in the hospital. They work somewhere where they're always in contact with COVID-19. They would be part of that number, just people who are being retested.
Yeah, repeated testing. If you're interested in getting tested, you can sign up on AZDHS site that he was just showing. The main page of that has both the nasal swab test and also the saliva test that's been so popular over at ASU. So the link is right there on your screen if you're interested. Even at this point in the pandemic, Garrett, I hear from people who are like, wait, it's my first time getting tested. Where do I go? What do I do? So although it feels repetitive to some people, there's a lot of people just doing this for the first time, or a lot of people testing over the holidays, and that's the site to go sign up, azhealth.gov /COVID-19 testing. The amount of time for when you get the test back varies, especially we've seen by site, Garrett, because those saliva tests were coming back sometimes in the same day, and then we saw this challenge over at Embry with the Mesa lab that wasn't able to keep up to speed.
Yeah, and when we look at SonarQuest, I'll check it right now, just because you talked about that. Our turnaround time is getting it's getting a little slower, but it's at 0.91. So it was 0.74, so they were still getting it done. Most of them were getting done in 1 day. Now there's a couple that are getting done in 2 days or 3 days. That's essentially what that means. Most of these tests are still getting done in 1 day.
But one thing I noticed, though, before Thanksgiving, there was a more drastic slowdown in the numbers. So a lot of people were thinking they could go get tested, find out by 10 o'clock that night or 10:30, and that just wasn't the case over Thanksgiving. We have been sort of monitoring it in the newsroom or checking in with coworkers who need to go get tested, saying, how long did it take you to get the results back, or how far out, I should say, did you have to book? We have seen that tomorrow is all filled up. So they're starting to fill up. There is space next week if you want one of those saliva tests, but with Christmas coming up, I'm sure it'll get even busier, and expect a little more delay in the response that's coming in. Other big change, we always seem to highlight at least one sports happening that's going on, and the 49ers have just extended their stay here in Arizona. So they will be using Glendale as their home for just a bit longer. The players' concern, or the concern from staff, was to let everybody know they'll figure out Christmas. They'll get your families to you, or they'll somehow have everybody reunite over the holidays when they were all sent from their homes in Santa Clara and sent here to Arizona. So yeah, Kim's writing in, her test results took 7 days at Embry Health. That was an anomaly. You're probably part of that delayed testing. Yeah. So glad you finally got your answers. Hopefully you got a negative result and you're feeling okay. Let's see.
RT.
That's
RT.
right. We have not gotten to that yet.
All right. Let's just go over RT really quick. Better news here. As we talked about, we are seeing some indications that our spread is leveling, and that is starting to be reflected in RT. It's now at 1.11. We've gone down the list. I think yesterday we were third or fourth. Now we're 1, 2, 3, 4, 5, 6, 7th. And you can see we're climbing down the list. There's more states in the green right now. We are not one of them, but we're getting closer to this sort of the single digits, if you will, the 1+ single digits. I expect that if the trajectories continue over next Wednesday or so, I think we're probably going to see one or two. We're getting close to seeing at least one of these in the single digits here very soon. But I think we're going to get closer to one if by Tuesday or Wednesday of next week we're still seeing a over week increases in our cases of only like 10%, less than 5%. We're gonna get really close to that one again if this continues.
Yeah. There's also a new county graph that I'm wondering if we can, I don't know if you guys have talked about it on my few days off, but over on Maricopa County's site in the age demographics, that is sort of an entire graph of the pandemic. So you can see where different age groups were testing or getting positive test results and how that kind of broke down based on, a 10-year age range. Yeah, on that demo page that just breaks down ages. It's a full pandemic line now, and it's kind of interesting to see. It doesn't have any of the changes plotted in, like kids going back to school or things like that. But as we know, around August that happens. So, are you able to share that graph, Garrett?
I am. I've got it up, and it actually gives a little more information here. So we're gonna. This is the age groups for all the weeks in the pandemic. I'm gonna take out. I'm just going to leave the 18-year-olds and lower to show what this looks like because it'll regenerate it. So here's what it looks like with the 0 to 5. So look, in fact, you know what? We'll go through these one by one. So this is what the 0 to 5 looks like for the kids. You can see we had a couple weeks where this most recent week, 606 cases of 0 to 5, and then and this is that summer pandemic. So obviously we've passed that for that particular age group. The really young kids. We're somewhere close to double where we were in the summer for that age group. When we go to the slightly older kids, we're obviously way past double. 475 was our peak on September or July 5th, excuse me, and our peak so far 1,362 and that's a lot. I mean that's a lot more.
That's a lot of kids.
Yeah,
and I know we've seen that kids fare better with this, but I just can't imagine as a parent how stressful that would be to get that result.
When we go to teenagers, we look like it's about double again. That seems to be a pattern with this age group is we're about double in these groups. And then and this one, obviously we're looking at larger numbers, 1,000 in July 12th, and on that's 1380, 2,304 on December 6th. So again, about double for that age group for the 2 different weeks. Now we get into some adults. You can see the 19 to 24. No, they were hit harder in July than they are being hit right now as far as case numbers. When we go to 25 to 44, you can see these numbers are almost exact. They're basically matching. You expect this is a large portion of our population, so you expect it to sort of match, and you can see that we're essentially matching the different peaks. 45 to 54, or 45 to 64, excuse me. Higher numbers right now. And then 65, you can see higher numbers here too. Our peak was 2,038 for July 12th, and now it's this most recent week at 3,078. So unfortunately, these are the age groups that are more impacted and are at a higher risk. Obviously, this one especially ages 65 plus. So this is not great news. You don't really want to see this number going up, especially this one.
Yeah. And so, Garrett, if we plug all the ages back in, do they mostly mirror each other, or is there, it kind of looks like so far.
Yeah, they pretty much are going to mirror each other. Yeah, see, they pretty much mirror each other. Obviously, there's more people in those, that 25 to 44. Mm-hmm. There's a lot more people in that demographic than the others. So, of course, it's going to be a lot higher than the others, and then 45 to 64 being the second largest, just based on the spread of age. So it's obvious that those are going to have the highest numbers because of that.
Yeah. Julie's saying the stores look a little bit emptier today than they were earlier this week. I'm assuming you mean people, not stuff. But I've seen some bare shelves in there too. How does mobility look right now? It's been interesting because we have a Target right up the street from the station, and I end up passing by there quite a lot, and it's kind of fascinating because it almost seems like the busier hours are like the off-peak hours. People are trying to visit. I think they're open till like 11 o'clock or midnight. And when I'm leaving the station, I'm like, man, that parking lot is packed. And anecdotally, I'm just wondering if people are trying to avoid the busy hours. I know a lot of stores have built in a lot of incentives saying if you do the pickup instead of coming in, we're going to give you, a $5 discount
Yes.
or whatever, or free pickup depending on how it is. How does mobility look? And would mobility be reflected then in just a run down the street to the store, or would you have to be going a little bit further from home to see that mobility?
You have to go a little bit farther. You have to go, I think it's 5 to 10 miles outside of your radius in order to be counted as someone who was I was mobile that day. And again, this is done with anonymized cell phone data. So I've got it shared, and this is what our mobility graph looks like for the entire thing. You can see this is Thanksgiving weekend, and then we had a big jump from after Thanksgiving weekend, and now we're back down. You can see if you look at the sort of the pattern, it is on the downward slope right now, and I would expect that to continue over time as we get closer to Christmas, especially. Those numbers should drop again. So we look like mobility is definitely going down in Arizona right now.
Yeah. We just have a matter of minutes left. I see Brant's comments. He's been so patient wanting to know about schools in Prescott Valley. Obviously, I'd contact your child's school specifically to get any information on COVID positive tests within the school. But where's the best place to check that overall for Prescott?
Schools in Prescott Valley, I would say the best place to see where the school's supposed to be and what status it's at is on the supervisor. Sorry, I've been dealing with the supervisor today. Superintendent Hoffman, the AZ Ed website, has a website where they'll tell you the status of each school. As far as the actual percent positives and data around the schools in Prescott Valley, Brent, I don't know. I don't have that info. I think the best way to get that is actually just to go to the schools or the school district's website, and there's a possibility that they will have COVID-19 specific metrics for their dashboards. Yavapai doesn't give us anything like Maricopa County does as far as like what a school district's percent positivity rates look like or anything like that. So you'd have to actually rely on data from the schools.
Yeah, Brant, I would, as much as I want you to stay, I'd hop off right now since it's not even 4 o'clock here in Arizona and try to see if they're answering, calling the school district and asking where their data dashboard is, especially because they're going to close for 2 weeks at least and not have anyone to answer the phone. So I'd call over there right away so you can hopefully get some answers. But the good news is, with all these kids now home from school, hopefully that will help just a bit to have that reprieve for 2 weeks. Okay, we are running out of time. I wanted to get to even more stuff, but it looks like we're going to be a little bit short on time. Garrett, is there anything that you're going to be watching over this weekend? I know the hospitalization numbers are always top of mind, and really should be a concern whether you care about COVID or not, because we're now hearing from people in our community, and I hinted at this yesterday where we had an email from somebody who said, I'm waiting for surgery on my foot. And I've been waiting for days to get a transfer to another hospital. And there's all these COVID patients around me. And I'm sitting in a hospital. Like, did they forget about me? They weren't feeding her because, of course, they're thinking you're going to be headed into a surgery at any point. So just a wild situation and reflective of how these high numbers in COVID cases then impact people who are there for something with their foot. So I talked about that yesterday. If you want to see the full reporting on her specific story and what happened and how really this could impact all of us, it's on abc15.com/coronavirus. It's right there in our reporting. It was Mike Pelton's story. So you can watch that. But back to the question, Garrett, what will you then be kind of keeping your eye on over the weekend?
We're looking, as you just aptly put it, the hospitalizations, and as you put it, I know people say, well, what happened to the flu? Well, at this point, our hospitals are full. So I don't know what the flu has anything to do with what the hospitalizations look like. Our hospitals are full. This is just a reality of where we are. And there is more concern by the doctors than there ever has been. So we'll be watching those numbers. We'll be watching, obviously, the COVID-like illness syndromic surveillance that comes out on Sunday to see what happens there if it continues to go up. And also, we're just going to be looking at how these case numbers are coming in and what dates are getting on, because we are, as I've said probably 3 times during this broadcast, is we're starting to see a peak, and we're starting to see a summit. And so that means we may start going down. And so that's very important. Are we at a peak? Are we going to start seeing lowering case numbers? The percent positivity is down, or excuse me, level. We're seeing, as I said, that the weekly case numbers are level. So there's some good news out there that we could be seeing the light at the end of this tunnel, at least for the cases, because once we get to the light of the tunnel of the cases, then we at least have an estimated time when hospitalizations will also start seeing a light at the end of the tunnel.
Yeah. I mean, the conversation around the PTSD just for our frontline workers after dealing with all this is going to be another crisis in itself, to have to help them heal. And as you touched upon, no matter what you call this, it could be misnamed, and people calling it the flu instead of COVID, which we absolutely know it is not. No matter what you call it, 312,000 people have lost their lives here in the United States, and it's a number that is climbing day by day. So we remember those families who are going through this tough season, especially during the holidays. Okay, matter of business, just so Garrett, you're not bombarded with a million emails. I'm off next week, planned. So I appreciate all the concern and messages that I got. Just taking time off to hang with the family over the holiday. As you remember, I don't think I took a day off through the whole summer. So now I have 10 days away. So I'll be at home, going from the kitchen to the living room, nothing that exciting, but at home to be with my family. So I just wanted to answer that question quick before you get bombarded. Like, where's Katie? What's going on? I'm fine. Hopefully we'll stay fine. So I hope you guys stay safe. I'll be back here with you on the 28th. Garrett, are you able to take some time off for the holidays?
I am. I will be taking some time off that week after Christmas, though. You and I will be together on the 20th and the 29th, and then I'm not here for the remainder of that week.
Yeah, then you're going to say, see ya 2020.
Yes.
Never want to see ya or hear about you again. All right. Well, I will see you on the 28th. In the meantime, Garrett, have a Merry Christmas, happy holidays, and I will see you on the 28th. This has been a long and wild year. And as I've said before, I would not want to be sitting here every single day for over an hour a day talking about something that's so difficult and so tragic with anyone that's made it easier than you. So thank you so much for helping us understand these numbers. It's been difficult, and I appreciate you. So with that, we will send it off. You can find Garrett and his Twitter account at Garrett_Archer. My Twitter account is at Katie Rammel, just one word. Facebook, many of you are watching here on Facebook, and if that's your preferred method, that is facebook.com/news from Katie. And our very latest coronavirus reporting, as always, abc15.com/coronavirus. Our next newscast coming up in just minutes at 4. We have one at 5, 6, 9, and 10 p.m. Be safe, everybody. We'll see you back here soon.